So what's your name?
My name is Jeremiah Long.
And tell me about what has been going on in your family recently.
So recently, the most recent death in our family was my sister. She had the vaccine, the Moderna vaccine, on the 5th of March of this year, and 9 days later she passed away. She had a pulmonary embolism and an enlarged heart, and that was probably one of the most traumatic things that we've had happen recently in our life.
Did she have any health conditions prior to this?
Not that we're aware of. The only thing that the medical examiner offered up as an explanation is that she was a bit overweight as to why she had those two items happen in her body.
Wow. And do you mind saying how old she is?
She was 42.
She was 42. Does she have children?
2.
And how old are they?
They're 14 and 11.
And so now we have a 14 and 11-year-old without a mother.
That's correct.
And you without your sister.
Yes.
And so what did they... So they said it was due to her being overweight. Did they say anything about connecting it to the jab?
They wouldn't confirm that. They just said it was coincidence as to why she wound up with a blood clot and an enlarged heart.
So this would probably be an example of a death that seems to be related to the jab that's not reported to VAERS. Is that fair to say?
It has been reported to VAERS, but it is related, I believe, wholeheartedly to the vaccine.
So who reported it to VAERS?
My brother did.
Your brother did. Tell us about your sister.
So she was my older sister, and she was born and raised here like all of my siblings, and she was great, fun to be around, life of the party. When I got word that she had passed away, I was working, and my mom was home with my wife, and probably the most devastating news that I'd received. Her 2 kids that she left behind loved her so much. And that's something that they'll be missing out on, is their mother and the interaction that they would have had as they got older. And that's the interaction that we're gonna miss because of her choice to get the vaccine. And that was her biggest thing, is that it was her choice. Just like it should be everyone's choice whether or not to get the vaccine. It shouldn't be mandated because it's not right. We all have the right to choose to get a vaccine, whether it's the flu vaccine or whatever might be available. But with the way that it's been rolled out, with these vaccines being mandated for healthcare workers, it's unfair. If it's really our choice and it's our body and it's our ability to make that health choice for ourselves, it should be. It shouldn't be an employer's choice. It shouldn't be an employer's choice to force someone to choose a religion of that employer's choosing, just like it shouldn't be their choice to force an unproven, still under emergency authorization use vaccine just because they're taking federal money to be able to operate. And that is what's sad, is that they're now becoming tools of the federal government to force that on themselves. Now my sister would say, well, you're just buying into the right-wing hogwash, and she's wrong. I have looked at the data since this came out back in December, November of 2020, 2019, and it is not something that we should just play around with, the vaccine. We should be able to study it, understand it, before it's mandated, before it's forced on people. And my sister was very liberal, and I loved her, and she loved me. And the playful banter that we had, because of our political differences, is gone. And I don't have anyone to do that with any longer. And that's what I'm probably the most sad about, is missing her and being able to have conversations about things like this.
What was her reasoning for getting the COVID jab? What was her thought process on making that choice?
She felt like she was doing the right thing for herself, for her family, for my mom. And so she bought into the media frenzy of, this is what I'm supposed to do as a good citizen, is to just get it and not really ask too many questions. She had the first vaccine she was doing everything that the government told her to do, masks, not going out in public unless you have to, staying away from people, just so that she could make sure not to catch the coronavirus.
So knowing what we know now, which is that this coronavirus is 98% plus survivable, right?
Mhm.
It's very survivable. Do you think that this sacrifice was worth the safety of the community of something like the coronavirus?
As far as the mandates and the lockdowns,
Losing your sister?
or losing my sister, well, I don't feel that it is. There have been people that I've spoken to in the community that have said, oh, well, she died for a good reason.
And what would you say to a person who says something like that to you?
I would say, why is it that she died for a good reason when other people have died from COVID-19 with a comorbidity? Why is it not good that they passed away? But it is a good thing that my sister died from having an experiment done on her. And that's how I feel. Whether that's right, that's really not anyone else's judgment to make, but that's how I feel.
Tell me a little bit more about your niece and nephew and what they will be losing now that they don't have their mother in their lives.
So my niece and nephew, they're 11 and 14. They're going to be missing a lot. She's not going to be there when they get married. She's not going to be there for any of their great achievements in life, graduating high school, graduating college, having grandkids. And that's one thing that my sister was looking forward to, was being able to enjoy those things with her kids. And now she's not going to have that, and neither are her kids, which is very unfortunate, because that's something that we as children growing up had an opportunity to spend time with our parents, our grandparents, and sharing those life experiences with them that now aren't going to be shared with their mother.
Right. You know, your family's going to have to come together in a way to fill in that gap for them, right?
Yeah, and it'll be difficult because they live in a different state. And so visits are going to be limited, obviously because of distance and financial reasons. And that's just unfortunately the way that life has dealt those kids and us as their extended family.
What a tragic loss for your family. I'm very sorry.
Thank you.